Welcome to the WRAL Daily Download. I'm your host, Amanda Lamb. For months, Republicans have been battling over items in the state budget. The biggest obstacle was a plan to expand gambling in North Carolina. GOP lawmakers finally agreed to table this for now so that the budget can finally move forward. The current proposal includes a 7% pay increase for state workers, including teachers, over the next 2 years. It also continues the goal of lowering the state's income tax and clears the way for major Medicaid expansion. Joining us to break it all down is WRAL state government reporter Travis Fain. Travis, welcome to the program.
All right, thanks for having me.
So we are talking Thursday morning. This is still a developing story, but you and I just talked off mic and you said, pretty much this is a done deal. No matter what the vote is, this is a done deal. So it sounds like these agreements have been reached and the budget, as you told me, was released on Wednesday. Tell me what we're looking at right now.
All right, it's $30 billion, so there's an awful lot going on. You mentioned the raises. Sometimes we talk about a 2-year budget because it actually has 2 years, but we kind of redo it every year, so it's $30 billion a year. Medicaid expansion is something that, after blocking it for 13 years, the Republican majority at the State House embraced, in part because the federal government passed what we call a sweetener, which is something like $1.5 billion. Think of it like a signing bonus. So that actually passed back in the spring, but Republicans, the majority, said, you know what we're going to do? That will only take effect once the budget passes. Now, what does that do? What does that give them?
Ties it together.
Leverage,
Yep. Right.
Leverage. So Governor Roy Cooper, there's a bunch of things in this budget he's not going to like, but he kind of has to swallow it to get Medicaid expansion, which will help, hundreds of thousands of people.
Absolutely. So the biggest stumbling block was this casino expansion, and everybody is not happy with this resolution taking it off the table, but it has been taken off the table. Explain what happened with this.
So for months, because usually you would want to have a budget in place by the start of your new fiscal year, which was July 1. Listeners may notice this is September. So why? Why did it take so long? Because Phil Berger, who is the top Republican, the top leader in the state Senate, was insisting on a deal that would have authorized 4 new casinos in North Carolina. Would have said, all right, we can build casinos in these certain counties, including Rockingham County, which is where Phil Berger is from. So he was pushing for these projects, and also something called video lottery terminals. Basically, there are a number of people who want to legalize sweepstakes or video poker, these things we've been trying to outlaw in North Carolina for 20-something years with limited success. Like, all right, throw it in the towel. We're going to legalize that. We're going to tax it. You put those things in gas stations and restaurants. So that was all tied up with the budget and with Medicaid. All these things are being leveraged against each other to get what people wanted. Berger was pushing the casinos particularly, and just this week said, all right, the votes aren't there for this. There were a lot of people complaining about having to support gambling to pass a budget or to pass Medicaid. There were a lot of people just complaining about the lack of transparency for this whole process because it was behind closed doors. People didn't even see a bill that would expand casinos for months while it was being discussed in secret by top leaders. So finally dropped that and said, all right, we're going to move forward. Budget still tied to Medicaid expansion, casinos, conversation for another day.
Okay, well, we will be right back after the break. Welcome back to the WRAL Daily Download. So you told me this is a 1,400-page document. Obviously, you haven't read every single word, but there are some big takeaways. And I guess the biggest one that really impacts our audience is raises for state employees, including teachers, but that's not as clear cut. So explain all that.
Yeah, it's actually better than that. It's 2 documents of a total of 1,400 pages, which must be read in tandem in order to understand them. We received it on Wednesday afternoon. It will be voted through the General Assembly by, 9:30 Friday morning. 4% raises for state employees this year on average. There's also some extra money for harder to fill positions. The state has massive vacancies. A lot of places running more than 20% vacancies, especially prisons, hospitals, state hospitals. So there's some extra money here and there to try to address that, but not nearly enough according to the State Employees Association, which is they don't have all the bargaining powers of the union, but that's the state employees union. So it's 4% this year, 3% next year, although that second year number is always something that can change because the legislature will come back in. Means the average state worker about a $57,000 average state worker salary. They're looking at a raise that'll get them, just under $60,000 this year. For teachers, it's more complex. We have this salary scale. The budget rearranges that. You get paid. You step up every year based on experience, and then the legislature decides how much to add on top of that. There are local supplements because, in Wake County, a teacher is going to make a lot more than a teacher in Stanley County because of the local supplements on top of the state.
So it's pretty complicated.
Yeah, it's a mess. But bottom line, beginning teachers who are early in their career are going to get a bigger raise than teachers who are later in their career. Teachers who are later in their career make more money overall, but their raise is going to be expensive relative because the idea is let's boost the beginning teacher, starting teacher salary.
Keep them, right. And that may not be something that the experienced teachers are going to be very happy about. So let's talk about income tax cuts. That was already started, but now the plan is to continue that.
And accelerate it. So corporate income tax is going to fall as eventually to 0%. That's not in this budget. That was already decided. That's going to continue in this budget. I can't remember how long, but I think 2030, somewhere in that area. Personal income tax, which is at 4.75% now, but the state personal income tax that you pay out of your paycheck, it's going to fall staggered every year or so. But if we hit certain revenue triggers, if the state budget picture is strong enough to justify it, we're going to go down to something like 2.5% in 2026. So, it's fairly complicated, but you're going to see slightly less money that you have to pay in state taxes. I think in the first year, it's like $74 less that a married couple making $100,000 would in a year would pay.
Well, I guess every dollar counts. So one of the biggest items, and we've already mentioned it, is the Medicaid expansion. Democrats were really lobbying hard for this, and it allows 500,000 more people to get covered. Just explain in a thumbnail sketch here what this will do.
Yeah, okay. Yeah, maybe people remember when Obamacare passed, the Affordable Care Act. We left this kind of hole in it where the idea was certain people would get supplements to get health insurance from the federal government, money from the federal government to do it. But people had to make a certain amount to qualify for that. They had to be in a certain window. Well, people who were fairly poor could not do that, could not get that supplement. The idea was states were going to expand Medicaid, which is a free insurance program, taxpayer-funded insurance program. A lot of Republican-controlled states said, no, we're not going to do that. So the federal government, Democrats at least, have been pushing states to accept this for 13 years. Finally, Republicans did this year. And it's going to be billions of dollars because when you go to the hospital or to the doctor now without insurance, if you go to the emergency room, you're going to get seen. It's going to generate a cost. We all pay that cost through insurance premiums and stuff like that. It has to be absorbed by the system. So a different part of the system is going to start absorbing those costs, and it's the state Medicaid program. Hospitals pushed hard for this because it's billions of dollars. It's, several 100,000 people who are going to benefit from this.
And of course, there is a huge laundry list of other things the Republicans wanted, including changes in the judicial branch, school vouchers, you name it. What else is standing out to you in this budget?
Yeah, the vouchers are a big deal. So right now we have in the state a private school voucher program called Opportunity Scholarships. It's a certain amount of money that you can get to send your kid to private school if that's what you want to do, several $1,000s. But you have to be under a certain income threshold. You have to be, you can't be real well off. All right, well, they're dropping that. Anybody can get it. Like even if you're a millionaire, you're going to be able to get it. You're not going to be able to get as much. I think you can get like 45% of what the state would spend to send your kid to a public school, the average per pupil. And we're going to increase the program pretty radically, like up to $500 million a year over the next several years. It will phase up to a $500 million program a year that anybody can access. You mentioned the judiciary. This budget raises retirement ages for Supreme Court justices from 72 to 76. Why? Well, maybe because Republican Chief Justice Paul Newby is going to be 72 soon, and they want him to be able to finish out his term. We have elections, partisan elections for our Supreme Court. Which party controls it is a big deal because the Supreme Court decides whether the laws the legislature passes are constitutional. We're also going to let Supreme Court justices carry concealed weapons in court. That's in this budget. Now, you may say, Travis, that does not sound like a spending priority. Why is it in the budget? Well, again, leverage. You take a $30 billion bill, you put what you want in it, good, bad, or otherwise, and you make people accept it because it's part of this larger bill. taxing Uber and Lyft. So there's a 1 to 1.5% tax on ride shares like Uber or Lyft in this bill. There is language forbidding local governments from banning plastic bag usage at grocery stores, something some local governments have talked about, that they won't be able to do it. Bill prohibits state agencies and local governments from making employees get a COVID-19 vaccination. There's an exception for hospitals, basically. There's a bunch more mental health funding. We need to learn more about how that's going to break down, but there's a lot of federal money, kind of post-pandemic money, and then I mentioned the sweetener, the $1.5 billion we get for expanding Medicaid. So there's a lot of money in this. Some of it, a good bit of it, is going to go toward mental health. And we're just going to have to wait and see how much that helps what is really becoming or has become a crisis in this state and in this country.
Thanks so much, Travis, for breaking this all down. And of course, we will have updates on this developing story on WRAL.com. If you'd like to hear more episodes, please follow the WRAL Daily Download in Apple Podcasts, Spotify, or just about any podcast app. Once you follow the show, you'll automatically get new episodes every weekday. Thanks for listening.